I was a veterinary technician for years, so I had worked with plenty of different animals, and then on the side I would do favors for ladies that would like to do dog shows, so I'd take care of their dogs and some of their farm animals. And I was in contact with chickens, and I was unaware with the medication I was on for ulcerative colitis that had put me at risk for getting the disseminated histoplasmosis, because I had no idea working with the chickens and going in the coop and getting the eggs that I could pick up something like that.
So histoplasmosis is a type of fungal infection that's found in the Ohio and Mississippi River valleys, so Missouri is squarely in that region, and it has various forms. So it's usually inhaled is how you can acquire it. The majority of cases are actually asymptomatic infection, or what we call subclinical, where you have kind of a self-limiting lower respiratory infection and it's never actually diagnosed. And then some people go on to develop pulmonary infection or pulmonary histoplasmosis, and then a certain subset of those will go on to develop what we call disseminated histoplasmosis, where it can spread throughout the body, so into the blood, into other organs, commonly the liver and the spleen, various lymph nodes, occasionally even into the brain.
I had like night sweats, I was vomiting, I dropped a lot of weight very quickly. Bad time appetite was not there. It just started taking a toll, and I could see that there was something wrong. I felt very ill.
So considering her case, you kind of figure out, okay, making the diagnosis is actually the trickiest part. She had initially presented with kind of non-specific symptoms of fevers, chills, night sweats, just not feeling well. And they imaged her and found that she had various organ involvement, swollen lymph nodes concerning for lymphoma, especially with the family history, and patients of her age can develop lymphoma. So the diagnosis eventually was made on a biopsy where they could see the microscopic fungi. So coming up with a treatment plan for her, number one is we have to be aggressive from the outset. So as it can mimic cancer as far as symptoms, it's also similar treatment as cancer when we're talking about disseminated. So we have to use this type of IV antifungal medication called amphotericin. So we had to have her in the hospital for a couple of weeks and give that medication daily, make sure she didn't have any side effects. Patients can have kidney injury with it, so we have to give IV fluids and check labs frequently. And thankfully she responded very well to the treatment, didn't have any problems. She actually got to go home a little bit early and finish the rest of the treatment as an outpatient.
He was able to explain what was going on with me and explain how we were going to go with the treatment plan. And he definitely made sure to keep up to date on with me, since I had to do blood work every couple days with the amphotericin. So he was very much about making sure all my levels and everything was wonderful, and tracking my progress as well as with the ulcerative colitis I have. And we were able to work with my GI doctors, and Dr. Beck was extremely helpful on all facets of trying to figure out what was going on with me and how to get better.
After that, we do kind of what's called a consolidated therapy, and we give an oral antifungal for 6 to 12 months. Given how long she had the infection and how much it had spread, we are going to opt for a 1-year treatment course total. And then as far as kind of big picture, so her main risk factor was her immune drug for her inflammatory bowel disease, so we worked with her gastroenterology doctors to switch her to a different immune medication that would kind of stay more localized to the gut and not affect the immune system outside of that area, so therefore kind of making sure we could cure the fungus and it doesn't come back. So we would treat her for a whole year, which will come up this fall of 2022, and at that point kind of monitor her periodically after stopping treatment to make sure it doesn't come back.
I'm feeling wonderful. I'm feeling more like myself. The medication, everything has been wonderful. I'm very happy to feel more like myself and not sickly.